Erythromycin Capsule, delayed release, Enteric coated, is a medication used to treat a wide variety of bacterial infections. It may also be used to prevent certain bacterial infections. Erythromycin is known as a macrolide antibiotic, and it works by stopping the growth of bacteria. It is important to note that this medication only treats or prevents bacterial infections and will not work for viral infections, such as the common cold or flu. Using this antibiotic when it is not needed can cause it to not work for future infections. The daily dosage and optimal timing for taking erythromycin capsule, delayed release, Enteric coated, will be determined by your healthcare provider based on your specific condition. Be sure to take the medication exactly as prescribed and for the full duration of treatment. This will help ensure that the medication is effective in treating the infection. When taking erythromycin capsule, delayed release, Enteric coated, it's important to follow your doctor's instructions. For best absorption, take it on an empty stomach, but if it causes nausea, you can take it with food or milk. Swallow the capsule whole and do not crush, chew, or break it. The dosage and length of treatment will depend on your medical condition and how you respond to the medication. For children, the dosage is also based on age and weight. To get the best results, take this antibiotic at the same times every day. If you're using it to treat an infection, continue taking it until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early could cause the infection to come back. If you're taking it to prevent infections, make sure to take it exactly as directed by your doctor and do not stop without their approval. Some common side effects of erythromycin delayed release capsules may include nausea, vomiting, diarrhea, stomach pain, and loss of appetite. Taking this medication with food may help reduce these symptoms. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication is prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, or hearing loss. Seek medical help right away if you experience severe dizziness, fainting, or fast/irregular heartbeat. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal pain, or notice blood/mucus in your stool, contact your doctor immediately. Do not use anti-diarrhea or opioid products as they may worsen these symptoms. Prolonged use of this medication may lead to oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While very serious allergic reactions are rare, seek medical help immediately if you experience symptoms like rash, itching/swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other unusual effects, contact your doctor or pharmacist. Also, remember that you can report any side effects to the FDA in the US or Health Canada in Canada. Before taking erythromycin, it's important to talk to your doctor or pharmacist if you have any allergies, especially to other macrolide antibiotics. Also, let them know about your medical history, especially if you have liver disease, kidney disease, or a certain type of muscle disease. Erythromycin may affect the rhythm of your heart, causing serious symptoms that need immediate medical attention. Be sure to inform your doctor about any heart problems you may have or if you are taking any other medications that may affect your heart rhythm. Additionally, low levels of potassium or magnesium in the blood can increase the risk of heart rhythm issues. Make sure to discuss this with your doctor, especially if you are taking diuretics or experiencing conditions such as severe sweating, diarrhea, or vomiting. This medication may also interfere with the effectiveness of certain vaccines, so be sure to inform your healthcare professional before receiving any immunizations. Before undergoing any surgery, inform your doctor or dentist about all the medications and products you are using. If you are on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, it's important to discuss this with your doctor. Older adults may be more sensitive to the side effects of this drug, especially hearing loss and heart rhythm issues. If you are pregnant or breastfeeding, consult your doctor before using this medication. When taking erythromycin capsule, delayed release, enteric coated, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is digoxin. Additionally, many other drugs besides erythromycin may affect the heart rhythm, including amiodarone, dofetilide, pymazide, procainamide, propafenone, quinidine, sotalol, among others. It's also important to be cautious of other medications that can affect the removal of erythromycin from your body, which may affect how erythromycin works. Examples include azole antifungals, such as itraconazole, ketoconazole, certain calcium channel blockers, such as diltiazem, verapamil, certain anti-seizure medications, such as carbamazepine, phenytoin, quinupristin, dalfopristin, sequinavir, among others. Erythromycin can also slow down the removal of other drugs from your body, which may affect how they work. Examples of affected drugs include bromocriptine, colchicine, certain benzodiazepines, such as midazolam, triazolam, elatriptan, ergot alkaloids, such as ergotamine, dihydroergotamine, certain drugs to treat erectile dysfunction ED or pulmonary hypertension, such as sildenafil, tadalafil, certain statin drugs, such as levastatin, simvastatin, vinblastine, among others. It's important to note that this medication may interfere with certain lab tests, such as urine tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has overdosed and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It is important to follow the prescribed dosage and schedule for this medication. Do not share it with others. This medication is specifically prescribed for your current condition and should not be used for another infection unless directed by your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one as scheduled. Do not take 2 doses at the same time. When storing erythromycin capsule, delayed release, enteric coated, make sure to keep it at room temperature and away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.